My name is Nikiforova Elizaveta. I'm from Center for Cognition and Decision Making at the Higher School of Economics, Moscow, and I'm a member of the neurodynamics team where I work with Pavel Novikov, Maria Nazarova under the supervision of Vadim Nikulin. And I really hope that all of you doing well during these challenging times. And anyway, today I would like to present to you our latest project. Supplementary motor area is a target zone for non-invasive neuromodulation. A systematic review of basic and clinical approaches. So today there are still different neuropsychiatric syndromes that remain pharmacoresistant, and one of them is catatonia, for which the electroconvulsive therapy is still the most effective treatment, even now in the 21st century. And it seems to be obvious that new approaches, less invasive, are necessary to be developed and invented to treat those patients. And repetitive transcranial magnetic stimulation and transcranial direct current stimulation could be those approaches, but there are still no protocols and no established protocols to treat those patients, and there are only several cases in the world today. So, and the important thing that supplementary motor area was discussed as a promising target for non-invasive neuromodulation in catatonic patients. Why supplementary motor area? What is supplementary motor area? So, supplementary motor area is a multifunctional brain area that is believed to be involved in many motor and cognitive functions. Supplementary motor area was described 70 years ago as one big area lies anterior to the primary motor cortex, but today it is not divided brain areas in other sources into 3 brain areas, distinct brain areas as supplementary motor area proper. You can see it here. Pre-supplementary motor area and supplementary eye field. Area proper, pre-SMA, are functionally different, but it is that they lie next to one another, and it is hard even anatomically to use them, and contemporary that dot anterior commissure, and that's where the border between those brain areas lies today. And so it gets challenging when you try to stimulate pre-SMA, not to disturb the brain area line next to it. And also it is important that supplementary motor area has a symmetric representation of the body, and it is with basal ganglia also symmetropic manner. The association is associated with basal ganglia and symmetropic manner. And repetitive transcranial magnetic stimulation of the supplementary motor area seems to be promising in 3 diseases. It is Parkinson's disease, obsessive compulsive disorder, and Tourette syndrome. So we're relying on all this information we get, we aimed with this system review, we aim to take a comprehensive overview of the SMA functional properties that were examined with RTMS. And we suggest that such systematic review would be helpful to develop new non-invasive protocols for neurological disorders is Catatonia that still remain pharmacoresistant, and there are no not really invasive treatments. So the methods we used in our systematic review, we followed and Prisma guidelines. We registered our systematic review in the Prospera system. Here you can see our registration number. Cochrane and Scopus that were available up to 27th of 2019. Also, 3 investigators assessed studies quality with Cochrane risk of violence tool, and all articles were divided into 2 categories. It was a study with healthy volunteers and studies including patients. And qualitative analysis was performed using narrative textual synthesis. Here you can see the study filtering process, so the flowchart. We downloaded 808 articles from the 3 mentioned databases. And after all filtering, we get left with the 92 articles we included into our analysis. Half of them were studies with only healthy participants, and another half included patients. So let's proceed to the results of our qualitative analysis. And first of all, let me show you the studies with only healthy participants that had positive outcomes with SMA as a target for RTMS. First, you can see that functions were examined as using inhibitory RTMS protocols, excitatory RTMS protocols, and articles were divided into 2 big groups: as motor control and cognitive functions. And here you can see that the most functions that were successfully modulated, as with inhibitors or with excitatory protocols, were successfully modulated sequence processing and motor inhibition, movement preparation, and bimanual coordination. Those we highlight as the most frequently studied functions SMA with RTMS. And I would like to highlight the emotional process, the process of emotions. Speaking of the pre-SMA studies with only healthy participants, well, we can see that it is much less studied than SMA, but also excitatory protocols were used, and were examined 2 motor control functions and 1 cognitive function of the SMA, and the most studied functions, 7 studies successfully motor vision with the RTMS SMA stimulation. And now let's continue with the studies with positive outcomes, where SMA was modulated by RTMS in patient groups. First, yes, also as inhibitors, excitatory protocols were used. SMA was chosen to target in Parkinson's disease, obsessive compulsive disorder, Tourette syndrome, autism spectrum disorder, bipolar affective disorder, and chronic pain syndromes. We can see that Parkinson's disease is the most investigated, the most examined disease with RTMS, SMA RTMS. And I would like to highlight that inhibitory protocols were used to reduce those symptoms and those of symptoms that are known as hyperkinetic. And I would like to underline once again that it is only positive outcomes. So in those studied investigators succeed use those symptoms. And excitatory RTMS was used to reduce hypokinetic symptoms and actually succeed to actually improved performance patients with self-initiated movements and with handwriting, improved handwriting of Parkinson's disease patients. There were 6 studies, 6 articles of where investigators succeeded to reduce compulsive symptoms, obsessive compulsive disorder, and also where investigated succeeded to reduce. And speaking of other of other studies, of autism spectrum disorder, bipolar affective disorder, and chronic pain syndrome. As for pre-SMA, there were only 2 positive studies where investigators succeed to reduce obsessive compulsive disorder symptoms, and also with inhibitory RTMS, investigators and excitatory TMS reduced restless leg syndrome. On previous slides, I showed you only articles with positive outcomes, and here I would like to show you the overview of number of studies and how many of them were positive, how many of them were negative. And here you can see studies with healthy participants, and here you can see the studies with analysis not only studies with that got significant outcomes, but also the negative studies. And at the end, I would like to say that our analysis highlighted and revealed very important functions of RTMS that would help further investigators and further medical doctors to invent new protocols, and as SMA functions as sequence processing, motor repair. Most importantly, that SMA was shown to involve more studies for motor inhibition than SMA. And speaking of clinical application, SMA actually seems to be a promising target for neuromodulation in patients with affected system, especially when we're talking about Parkinson's disease, obsessive compulsive disorder, and Tourette. Of course, we combined and systematized what was already known, but this systematic review, we hope when our investigators and doctors develop new neuromodulatory RTMS protocols for such resistant as Catatonia. Thank you for your attention.